The beauty of Africa is the unending laughter of her people, the happy moments shared in the brightness of the sun during the day and glow of the moonlight. Africa is the cradle of children playing hide and seek, kicking balls made of polythene and papers, and running barefoot along paths and alleyways. But in Africa's stagnant waters, ponds, broken tins, lurks the Anopheles mosquito, whose bite causes one of the deadliest diseases known to man, malaria. The World Health Organization estimates that there are about 250 million malaria cases each year and approximately 1 million malaria-related deaths. But following a rapid and large-scale deployment of interventions, an estimated 485 of these children are being saved every day from malaria. Achieving and maintaining a universal coverage through to the year 2015 may save well over 3 million lives. In Kenya, the government, Kenaam, and its partners are the frontier for malaria cure and prevention.
Kenaam stands for Kenya NGO Alliance Against Malaria. Is a network of non-governmental organizations, privately based organization and community-based organization that attest to malaria and the integrated management of childhood illnesses in the programming. Kenaam bolsters the government efforts to reduce Kenya's malaria burden by coordinating civil society, resources so that the intervention in malaria and prevention are scaled up without duplication.
We would agree that Kenaam is unquestionably a timely mechanism for coordinating CSO and government engagement with regard to malaria management in Kenya.
Whether we're in the NGO world, whether we are in government, whether we are in politics, whether we are at the community level, or whether we are at the global level where most of our donors come from. We want to continue to advocate for partnership, since it's only through partnership, through doing things together with one mind, for one purpose, that we can make Kenya malaria free.
Well, I think really Kenaam is doing very well. Because it's different organizations being put together, and I think really we have to start working together. We have to start not saying, I want to raise my flag. I think if we all work together, we can break down the barrier.
Since its inception in 2008, Kenaam is the focal point of the civil society organization Kenya for malaria, and it sits in all technical working groups in the Division of Malaria Control, including M&E, Drug Policy, Advocacy and IC, as well as Malaria and Pregnancy in the Division of Reproductive Health. Kenaam has a proven record in liaising with the Division of Malaria Control, and our vision is a malaria-free Kenya. If you want to walk faster, walk alone. But if you want to walk far, walk together. Let us all walk together so as we realize our vision of a malaria-free Kenya.
Today we are relaunching the 3 reports that have been prepared by the Rollback Malaria Partnership. The first impact series brings together the activities that has been happening globally for the last 10 years implemented by the Rollback Malaria Partnership partners. The second impact series is the World Malaria Africa Update, which shows how far malaria is still contributing to the disease burden globally. For example, we have around 46 to 60% coverage, which is still below the agreed RBM 2010 target. And it's the highest that has been achieved is in Ethiopia, which is around 60% coverage. The third report is the Saving Life Through Malaria Control, counting to the Millennium Development Goal, and analysis with the life-saving tools. It brings important factors that are in the model, that is number of child deaths in the baseline year, effectiveness of malaria control intervention, and estimate of changes in the intervention coverage and scale up.
More lives could also be saved every day, and many more lives could be saved with increased or sustained and maintained malaria prevention coverage throughout 2015 as per the Millennium Development Goals. So if we want to continue to progress in child and maternal health, long-term predictable funding is essential. And only with long-term predictable funding do we have any chance of achieving Millennium Development Goals. So I call the donor community and everyone in this room that we take a role to see that we raise enough resources.
But once we access the funding, we thought it would be very important to bring in the Ministry of Health, and we invited Dr. Kwale here to become the principal investigator, because we thought him being the policy maker, he would be the right person to use the outcomes of these results, and we would not have to go and lobby for the evidence to be utilized in this. We think this is a unique sort of partnership between government and NGOs, where the results of a study do not sit in a shelf, where there's complete ownership of the results by the government. Now, the study set out to assess whether community health workers can be used to increase access to effective malaria treatment and to improve other essential malaria-related knowledge and behavior. In this study, we targeted hard-to-reach areas. The hard-to-reach areas were defined as areas that have some distance, maybe 4 to 5 kilometers to the health center, where people could not access health care because of either poverty or because the infrastructure was not there, or where the personnel were not there. We then carried on the activities, which included the selection of the community health workers, intensive training for the community health workers and their coaches who were part of the government formal workforce. These were public health officers and the nurses who were at facility level, so that our volunteers at the community level were working completely linked with the facility level workers.
The main findings from the Kenya Home Management of Malaria Project showed: 1. Community approach to malaria treatment works even in most remote areas. In this country, it is most rural areas. All we have to do is to provide effective medicines to trained local volunteers. 2. Adenosine-based combination therapy. Policies that limit drug access should be revisited. The Kenya Home Malaria Management Study reaffirms studies in other parts of the world that trained community workers can safely distribute and administer malaria treatment. In this country, it is common knowledge most episodes of malaria are first treated at home among shop port anti-fever medicines, herbalists, or in some extreme cases, the use of witch doctors. Unfortunately, these modes of treatment are usually incorrect and suboptimal. Though progress has been made towards increasing access and utilization of key malaria prevention initiatives, it is apparent that the country has to redouble its efforts if the dream of having a malaria-free Kenya by year 2017 is to be realized.
Since most deaths occur in Africa and Asia, it is saddening to note that the world will not achieve MDG 4 at the current level of progress. Nearly 9 million children die every year before the age of 5. That is nearly one child every 3 seconds. 1, 2, 3.
Majority of the children who die from malaria do so within 48 hours of the onset of the illness. The early use of correct anti-malarial medicine under the supervision of a trained community health worker close to the home can reduce the burden of malaria in Kenya.
The way forward, we look at it from this context that 485 children are saved every day in Africa from dying of malaria. These 2010 estimates represent an 18% reduction in malaria-related death among children compared with that in 2000, when the Abuja targets were being set.
2010 is a milestone year for malaria, which has recorded over 50% reduction of malaria deaths and cases, and thus tracking the progress of the investment that has been very vital to this reduction.
Malaria investment has a high level of return on investments, and lowering the number of lives lost to malaria helps to achieve the MDG goals 4 and 6. At a total cost of $1,025 to save one life.
Now, as government, therefore, this year, the Ministry of Public Health and Sanitation plans to distribute in the first 6 months close to 5 million insecticide-treated nets in a campaign that will target especially the districts with a high burden of malaria in Western and Nyanza provinces, now counties in those provinces, former provinces, and in the coastal region of Kenya.
Now, I think it's important to have partnerships with governments, partnerships with civil societies, partnerships with NGOs, and partnerships with business people, because I'm sure business people don't just want to take and make profits and just look at the bottom line. They also want to give out there.
It's one of the strategy we have been investing in this as government, and we've invested a lot in communities. It is an expensive activity, and we hope that the partners who are here will continue supporting this country, especially in areas where we still have a high transmission of malaria in Western and Nyanza provinces.
Now, conclusions of the project demonstrated, just like many other projects in West Africa, that the use of community health workers is a viable method of making ACTs available to the communities. Results show that the change over time of treatment-seeking behavior and access to ALs. Now, this information is available, and the community health workers are people who live in these communities, and the information on treatment-seeking behavior, on prevention, and on referrals is available in these villages. They don't have to walk to the health facility where the nurse would likely have 30, 40 people and cannot spend enough time explaining some of the issues around behavior with regard to treatment.
We don't need to wait for our governments to do things. Yes, they should be accountable, but we should not just give up and say we don't see the light at the end of the tunnel. Me, as a musician, I took it upon myself to want to do this because I thought I do have a platform. So many people buy my records, and I'm never going to die and take all this money with me. So I wanted to help my communities.
And I want to ask you or say to you, still so many questions I don't know. Realize to question is how we grow. So I step out of the ordinary. I can feel my soul ascending. I'm on my way, can't stop me now. You can do the same. What have you done today to make you feel proud? It's never too late to try. What have you done today to make you feel proud? You could be so many people if you make that break for freedom. What have you done today to make you feel proud? What have you done today to make you feel proud?